The next item of portfolio questions in education and skills. I listened to the last session, so in order to get as many in as possible, like short, succinct questions and answers to match. Questions number 2 and 3 are grouped together. You know, if you want a supplementary, those you come in at the end of the third question. Question 1, Shona Robinson, please.
Thank you, Deputy Presiding Officer. To ask the Scottish Government what further action it's taken to close the attainment gap in Dundee in the light of the challenges due to the COVID-19 pandemic.
Cabinet Secretary John Swinney, please.
Presiding Officer, our focus on tackling the poverty-related attainment gap remains central to the Government's agenda. Dundee City Council has been allocated over £11.6 million for 2020-21 through the Scottish Attainment Challenge, including pupil equity funding. In response to COVID-19, I have committed a further £135 million to support the return to school. Of this, Dundee will receive almost £1.5 million to recruit additional teachers and support staff. Dundee will also receive over £760,000 to tackle digital exclusion. Education Scotland Attainment Advisors will continue to work closely with the City of Dundee to accelerate recovery and tackle the attainment gap.
Shona Robinson, please.
Thank you. Can I welcome those resources? And can I ask the Deputy First Minister more specifically what action is being taken to support care-experienced young people in Dundee to help break down the barriers faced by our most disadvantaged pupils?
Cabinet Secretary, please.
Officer, the focus of the Attainment Challenge is very much on meeting the individual needs and experiences of young people who are affected by a background of poverty. The schools will be focused increasingly on using pupil equity funding to meet the needs of care-experienced young people. But as part of the education recovery resources, we have also made available resources to support the implementation of the promise, which was the commitment made through the independent care review to meet the needs of young people who have the experience of care. And those resources, I hope, will be taken forward in an approach around the whole concept of holistic family support to make sure that the best outcomes can be achieved for young people who face such disadvantage.
Thank you. Supplementary from Ian Gray, please.
Thank you, Presiding Officer. Prior to schools going back, Mr Swinney promised to produce an equity audit to ascertain the impact of school closure on the attainment gap and inform an action plan for trying to redress and mitigate that impact. When will we see that?
Cabinet Secretary, please.
Presiding Officer, the equity audit will be developed as we see the experience that essentially emerges from young people returning to school. One of the early indicators are the number of referrals for assistance in relation to young people that have arisen out of young people returning to school has increased, and as a consequence, some of the anxieties that I expressed to the Education Committee before Parliament about the emergence of further need of support amongst vulnerable young people looks likely to be emerging. So we'll be reflecting on that practice as it informs the actions that we take forward, and I will keep Parliament updated on the development of the equity audit and how that is reflected in the policy decisions that the Government makes.
Question 2, Gordon Lyndhurst, please.
Deputy Presiding Officer, to ask the Scottish Government what assistance it is offering to local authorities to respond to COVID-19 outbreaks among young people in school estates.
Cabinet Secretary.
Presiding Officer, local outbreaks are principally managed by local health protection teams who provide support to schools around incident management. The Scottish Government is providing a range of assistance in terms of guidance and resources to support schools and local authorities in the return to full-time schooling.
Gordon Lyndhurst, please.
Thank you, Cabinet Secretary. Parents and pupils throughout Scotland, including Lothian region, are rightly concerned about safety as pupils return to school. I wrote to the Cabinet Secretary on 27th July about this, but his reply did not answer my question about what inspections and tests have actually been carried out on school plant, equipment, classrooms and systems. Is he now able to respond to my question and confirm whether or not guidance has actually been implemented?
Cabinet Secretary.
Presiding Officer, I would like to reassure Mr Lyndhurst about the approach that's been taken within schools, because I recognise the importance of the question that he raises and the necessity of staff, parents and pupils being assured of the safety of schools on their return. Individual schools will have been required to undertake a risk assessment to satisfy the requirements of the Education Recovery Guidance. And they will also have been required to follow the mitigating measures within the Education Recovery Guidance to produce a safe environment. That work has been undertaken, and Her Majesty's Inspectorate of Education have reported to me on the steps that have been taken to ensure that is the case. In addition to that, the Health and Safety Executive carries out surveys of schools to satisfy themselves, which is their statutory right to do so, that the appropriate measures in relation to health and safety have been taken by schools. That work has been undertaken and will continue to be undertaken by the Health and Safety Executive, and I hope the presence of that work provides reassurance to families the length and breadth of the country.
Alistair Allen, please. Question 3.
Thank you, Presiding Officer. To ask the Scottish Government what funding it has allocated to local authorities to ensure that, in light of the COVID-19 pandemic, schools will have adequate resources to keep pupils and staff safe.
Cabinet Secretary, please.
Presiding Officer, the Scottish Government takes the safety of pupils and staff in schools very seriously indeed. That is why we've committed up to a further £135 million over the next 2 years to support the reopening of schools. This includes making up to £50 million available to local authorities to support the costs associated with safely reopening schools, in line with the guidance published on the 30th of July, and £80 million for additional teachers and classroom staff. This is in addition to the £155 million in UK Government consequentials passed on in full to local authorities on the 26th of May.
Alistair Allen, please.
I thank the Deputy First Minister for his answer, and I welcome the Scottish Government's ongoing efforts to keep pupils and teaching staff safe. Can I ask the Deputy First Minister what action the Scottish Government is taking to discourage for the moment house parties, which we know were linked to a number of cases in secondary schools since their reopening?
Cabinet Secretary.
Presiding Officer, there is very clear guidance available about the limited numbers of households who should be gathering together for indoor household purposes. And as Dr Allen has correctly said, a number of the cases where we have identified pupils who have tested positive from COVID have arisen out of connections between those pupils at house parties where quite clearly more households were present than should have been the case. So the general guidance that affects this question is available to all. We encourage compliance with that guidance in the way that we had exceptional compliance with the guidance in the immediate aftermath of lockdown. And of course the First Minister has been very clear in expressing the concerns that we have about indoor house parties and the danger of circulation of the virus that is posed as a consequence of such gatherings, which are not compatible with the regulations. In addition to that, the First Minister today set out further details on the experience, on the powers and responsibilities that will be available to Police Scotland to deal with such incidents in the future, which we would rather not have to exercise by individuals deciding not to gather for the said house parties.
Brief supplementary, Daniel Johnson, please.
Thank you. I've been in touch with many sporting and youth work organisations who are unable to resume their work in schools because of the understandably cautious approach to interpreting the guidance on reopening schools that local authorities have taken. Can I ask what support the Scottish Government is giving to local authorities to adopt improved policies that may permit these activities under the current guidance, or what revisions to guidance will be made to enable this vital education work?
Cabinet Secretary.
President Officer, I recognise the importance of the work that Mr Johnson raises, and I very much regret that we are not in a position to enable a lot of this work to be undertaken because of the necessary and cautious approach that's been taken. I can assure Mr Johnson that all guidance in relation to schools is developed by the Education Recovery Group, in which our local authority partners are key participants, and we work closely together to make sure that local authorities are fully involved in the formulation of that guidance. The Education Recovery Guidance has, of course, been supported by the Convention of Scottish Local Authorities, and if there are any opportunities to revise that guidance in light of the public health advice that's available to us, we will, of course, take them. I have allocated additional resources to the youth work sector to support their activity, recognising the importance of the points raised by Mr Johnson, which is important in strengthening the opportunities available to young people in our society.
Question 4, Donald Cameron.
To ask the Scottish Government whether it will provide an update on the action it is taking in response to the UHI publication, The Gaelic Crisis in the Vernacular Community.
Cabinet Secretary.
Presiding Officer, the Scottish Government welcomes new ideas and opportunities to promote and improve the use of the Gaelic language. This UHI publication raises concerns about levels of Gaelic use in some island areas, and in July I met with the Chair and the Chief Executive of Bord na Gaelic and with policy officials to discuss the issues raised in the report. There are at present a range of important interventions in place which we will continue to support. In addition, I will initiate a consultation to give community organisations in the islands the opportunity to give us their views on how to improve the use of Gaelic in the islands. We will also further reflect on these issues at a discussion which I will host next week on progress in implementing the range of measures that arise out of the 5-year National Plan for Gaelic as part of the annual update.
Donald Cameron, please.
Since this report was published, there have been informal cross-party discussions amongst MSPs, councillors and others about the vital next steps and what might be done at a local community level. But will the Cabinet Secretary commit today to attending an urgent meeting or summit of elected representatives and other stakeholders so that we can address the various issues raised by this report and determine a viable way forward to ensure the long-term future of the language?
Cabinet Secretary.
So, first of all, can I welcome the constructive contribution that Mr Cameron has made to this important debate, and to recognise, as he rightly records, the cross-party support for the development of the Gaelic language. I think that is critical for to take forward a range of steps that are broadly supported within the political community in Scotland. As I indicated in my original answer, I will initiate a consultation involving community organisations. I would prefer to allow that to take its course, to hear the voices of communities very directly so that they can influence and shape the agenda moving forward. Thereafter, I would be very happy to take part in discussions with members of all political parties and with local stakeholders and council representatives and with communities to address how we might respond constructively and imaginatively to the thinking that emerges from the communities most interested in the development of the Gaelic language.
I've just got over 6 minutes and 3 more questions, so I think it's going to be difficult for supplementaries. Question 5, Lewis MacDonald.
Thank you very much. To ask the Scottish Government how the views of young people will be taken into account in decisions about schools over the next few months.
Cabinet Secretary.
Presiding Officer, in June I met with a panel of learners to discuss their experience of school closures and the coming school year. I will continue to take opportunities to listen to the views of young people and to ensure those views are considered fully in decisions about schools. Young people will be consulted during the OECD review of Curriculum for Excellence, Professor Priestley's review of the awarding of the 2020 qualifications, and the SQA's consultation on 2021 qualifications. We are also working closely with the Young Scot organisation on the promotion of essential messages, particularly around school safety and the wearing of face coverings.
Lewis MacDonald.
Thank you very much. The Cabinet Secretary will know that a minority of young people feel their grades are lower than they should be on the basis of their teacher assessments, but they do not meet the fairly narrow criteria for appeals as set out by the SQA. What should young people in those circumstances now do?
Cabinet Secretary.
Fundamentally, Presiding Officer, I would encourage young people who have any concerns about their grades that have been received for them to discuss those with their schools. That is the appropriate channel for taking forward of these concerns. I am confident that there's sufficient scope in the appeal criteria that's been set out by the SQA to enable any particular issues that require to be addressed. But the starting point for those discussions is dialogue between young people and their schools.
Beatrice Wishart, please.
Deputy Presiding Officer, I previously asked the Cabinet Secretary why the Education Recovery Group doesn't include any young voices. Young people have shown time and again to be deserving of a seat at the table, but the voices weren't heard in amongst decisions being made about the 2020 exam diet and the return to school. So will the Cabinet Secretary now invite young people to join these discussions going forward?
Cabinet Secretary, please.
I'm very happy, as I hope my original answer set out, to hear the views of young people as part of this process. We tend to do that through channels where we can gather the views of a range of young people, rather than taking the view that, for example, one young person being on the Education Recovery Group satisfactorily addresses all the different perspectives that we will hear from young people. But I would assure Beatrice Wishart that we take particular care to listen to the views of young people in a number of forums. We listen carefully to some of the survey findings that come from the Young Scot organisation, which reaches very effectively young people within our society to enable us to be able to reflect constructively on the points of view that they have and the aspirations that they set out.
Question 6 is not lodged. Question 7, Jeremy Balfour.
Thank you, Deputy Presiding Officer. To ask the Scottish Government whether it will provide an update on the required social distancing measures in schools.
Cabinet Secretary, please.
Presiding Officer, the guidance on the reopening of schools published on the 30th of July provides detailed advice on physical distancing in schools. That guidance provides on the basis of scientific advice and subject to all other risk mitigation measures being appropriately implemented in schools, that there is no requirement for physical distancing between children in schools. 2-metre physical distancing between adults and between adults and children and young people who are not from the same household should be maintained. As the guidance also makes clear, the implementation of the guidance on the return to full-time schooling has been monitored closely, and I am committed to ensuring that it is kept under review and updated when necessary in line with the ongoing scientific advice.
Jeremy Balfour.
I thank the Cabinet Secretary for his answer. I've been contacted by a number of parents and school councils here in Edinburgh whose children have been kept away from school with colds, runny noses and sore throats. They have no other symptoms, and yet the schools are saying they cannot go because of guidance from Edinburgh City Council. Would you look at giving fresh guidance to local authorities to make sure that children can go to school if they've just got a small cold or a cough, rather than stopping lots of staff and lots of teachers not entering the building?
Cabinet Secretary.
I recognise that this is a finely balanced issue, and that there will be anxiety within the school system about the presentation of symptoms which all of us would recognise to be quite simply the routine colds that circulate at this particular time of the year and also when schools return. Care has got to be exercised, but the First Minister at the briefing at lunchtime today set out some of the data around the level and prevalence of COVID amongst children and young people within our society, and it is at a very, very low level in amongst young people, and there has been a massive increase in the number of young people being tested for COVID. The number of positive cases is significantly less than 1%. So there is obviously a lot of anxiety. I would encourage parents and schools to exercise care in making a judgment about the routine codes that exist at this time of year and try to maximise the opportunities for young people and children to be able to access learning.
I'll need to ask everybody to be very brief from now. I'm going to squeeze Claire Adamson with a very brief question, and I want to bring in Finlay Carson with the last question. So, Claire Adamson.
Thank you very much, Presiding Officer. Mrs. Swinney, in the Chamber I mentioned concerns about photographs of a school in my area earlier in the week. Can you reassure and affirm that while the guidance on face masks is welcome, that the other elements of class and social distancing, hand washing are equally and just as important going forward to ensure that we minimise the risk of virus spreading?
Cabinet Secretary, if you can briefly, please.
Presiding Officer, I would like to take this opportunity to make it crystal clear, as I did in the Chamber earlier on this week, that there are a range of mitigation measures that should be followed, one of which is the wearing of face coverings in communal areas. But by far the most effective technique in reducing the spread of the virus is about ensuring physical distancing and ensuring cleanliness in terms of hand washing and in the cleaning of surfaces. These are absolutely fundamental elements of the approach that we take, and they all must be pursued.
Question 8, Finlay Carson.
To ask the Scottish Government how many additional support teachers have been recruited in light of the impact of the lockdown on pupils' studies.
Cabinet Secretary, please.
Fencing £80 million for the recruitment of an estimated 1,400 additional teachers and 200 support staff this year to bring much needed resilience to the education system and to support children and young people who have suffered loss of learning during lockdown. Local authority recruitment of additional teachers is underway, informed by ongoing assessment by schools and local authorities of the needs of children and young people during the first few weeks of their return to school. Once this process has concluded, we will be in a position to provide the number of additional teachers that have been recruited.
Finlay Carson, please.
I thank the Cabinet Secretary for that answer. Young people, as we know, have been disproportionately affected by the coronavirus, and the Scottish Children's Service Coalition has referred it as lost generation. With its government's previous record of 1,000 fewer ASN teachers in Scotland than there were in 2010, can I ask the Cabinet Secretary whether he believes that one ASN teacher to over 70 ASN pupils is an acceptable level of support, and what target would you like to meet in terms of ASN teachers in post across Scotland?
Cabinet Secretary.
It's important in addressing the statistics given by Mr Carson to recognise that the definitions of pupils that are identified with additional support needs has changed very dramatically in the period over which he raises his question. And we view the importance of all staff being able and equipped to meet the needs of young people, which will be of a variety of ranges of additional support needs. So we're now at a position in Scotland where we're at a 10-year high in the number of teachers in the profession, where I've made provision for 1,400 additional teachers to be brought into the education system in light of COVID, and with other opportunities for us to supplement the scale and the size of the teaching profession. So there are a range of measures being taken to make sure that the needs of all young people can be properly and fully met as part of the work that is undertaken in their schools.
Well, thank you very much. That concludes Portfolio Questions on Education and Skills. I suspend this meeting until 3 p.m. Thank you all very much.
Thank you very much. We now resume with the final portfolio question session, and the final portfolio is health and sport. As ever, if members wish to ask a supplementary on another member's questions, please enter R in the chat function. And I am keen to get as many members in as I can, so please keep questions and answers as succinct as possible. And can we start with question 1, Alison Harris.
Thank you. To ask the Scottish Government what progress it is making in its commitment to carry out weekly COVID-19 tests on all care home workers.
Cabinet Secretary Jean Freeman.
Thank you, Presiding Officer. So, as the member knows, I advised the Chamber on the 19th of May that all care home staff would be offered COVID-19 testing, regardless of symptoms, and that this would be undertaken every 7 days. And I can confirm that all care home staff in Scotland now have access to that weekly testing. Of course, not all staff are available every week. Staff may well be on holiday or off sick or maternity leave or on other leave. So our agreed aim is to test 70% of available staff. The latest statistics for the week commencing the 14th of August show that 36,986 staff were tested, which is a proportion of staff available is over 75%. All care homes have access to the UK Social Care Portal since the 8th of June, and we have secured 67,900 tests per week, with over 90% of our care homes ordering through the portal.
Alison Harris.
I thank the Cabinet Secretary for her response. However, despite the aim of 70%, which granted has been met, last week it was 17,000 of 53,000 staff failed to be tested. And in the 5 weeks prior to that, the numbers have ranged from nearly 17,000, 16,872 to 19,000. This is remaining high at a constant slightly over a third of staff. Surely all those staff can't fall into the category of holiday, sick pay or maternity leave categories. So what other explanation can the Cabinet Secretary offer for these failed and missed tests?
Cabinet Secretary.
So just so we are factually accurate, in terms of the percentage of available staff tested for the last 6 weeks, it has gone from 69% to 72 to 75, 76, 2 weeks in a row, and actually the week commencing 14th of August, it was 77.7%. In that time, so this is one of the explanations, the number of staff who are declining to be tested has reduced from just over 2,500 in a week to, in the most recent week for which we have figures, 1,014. But not all of our care homes are in any 1 week either participating in the weekly testing, or in that week do we have all of their results back in. So in every week there will be some missing results, but there are also a declining number, I'm pleased to say, of both staff declining testing and care homes participating in testing. Having now made the regular participation in weekly testing one of the criteria that care homes must meet in order, for example, to take part in the extension of visiting through the designated indoor visitor for each resident, I'm sure that we will see an increase both in the numbers of care homes participating in this weekly testing regime, but also in the number of staff. We have addressed some of the issues with staff, as the member knows, particularly through the Social Care Fund, with the cooperation and the initiation from Ms Lennon. That fund addresses the poor terms and conditions of some staff who were only receiving statutory sick pay if they tested positive, and were therefore fearful of being tested at all, lest that positive test be returned because the reduction in their income would be so significant and so harmful to them and their family. We have a group working with unions, my officials, Scottish Care, looking every week at the particular issues that might be preventing staff participating in testing or a care home participating in the programme, and looking to resolve that in real time.
A brief supplementary, please. Willie Coffey.
Thank you. Could I also ask the Cabinet Secretary if she'd be able to provide a brief update in the work of that short-life consultation group, which was established with union and care home management reps, to understand those concerns a bit better about staff having weekly testing?
Cabinet Secretary.
Thank you very much. Yes, the Short Life Working Group has met on 6 separate occasions, and as I said earlier, it has looked at a number of key operational issues, so it's very task-focused, if you like, and looked to how we can resolve those. Most of them have now been addressed. They've included the introduction of full weekly ordering of test kits to make the ordering burden, if you like, on care homes less onerous, bulk uploading of tests once completed, amendments in terms of the user guidance for the social care portal, and we have also produced a video encouraging staff to participate in staff testing. The group will continue to work exploring any issues that are raised with us, either from the unions concerned through their membership or from care home managers themselves.
Further brief supplementary, Jackie Bailey.
Cabinet Secretary will be aware of my repeated requests for local testing facilities, both for care home staff and indeed for local residents in my area. Last week I had parents and their children being told to travel to Dunoon, Stirling and Edinburgh. Indeed this week it was even further afield to Belfast and to Carlisle. So will the Cabinet Secretary tell NHS Greater Glasgow and Clyde provide local facilities in Dumbarton, the Vale of Leven or indeed Helensburgh, both for care home staff and so that sick children aren't having to travel hundreds of miles?
Cabinet Secretary.
So Ms Bailey raises a really important question here, and as I'm sure she knows, there are at this particular point a number of challenges being faced by our testing regime. As she knows, and other members will do, we undertake that testing regime through 2 main routes. The first of those is the UK portal, where people can book a test, and the tests are processed through the Lighthouse Lab in Glasgow. That Lighthouse Lab is part of a network of 3 UK Lighthouse Labs, and over the whole of the UK there has been an upsurge in demand. That demand has then meant that some of the testing facilities where you can go to be tested have been capped at a UK level, and the lab at Glasgow, the Lighthouse Lab in Glasgow, has been undertaking more tests from south of the border, processing those tests, than from Scotland. All of that has created some of the difficulties that Ms Bailey's constituents and others have faced. We're working very hard with the UK government to resolve these issues, and we're also working hard to increase our NHS capacity for testing, which is the other route that we use, so that we can, if we have to, redivert some of those dedicated testing groups. That includes care home workers, teachers, NHS staff and others through the NHS route, if that is what we need to do. So all of that work is underway. The additional point I would make that may help in Ms Bailey's particular instance is the introduction of walk-in centres. The first of those will open in St Andrews next week. There will be then another 10 rolled out across Scotland, initially focused particularly around our university student population, which, as you know, will grow considerably over the coming weeks. But following those, a further group of walk-in centres will be introduced, and I've already made it clear to my officials that I want to see those centres pick up in areas like Ms Bailey's area, Inverclyde and other parts of the country where there is a high population but limited accessibility to local testing facilities.
Thanks very much. Can I remind all members of the need for succinct questions and answers? And call question 2, Maurice Golden.
Thank you, Deputy Presiding Officer. To ask the Scottish Government what analysis it has carried out of the physical and mental health impact on fitness facilities and service during the COVID-19 pandemic.
Minister Joe Fitzpatrick.
The Scottish Government recognises the impact of indoor sport and physical activities being closed, and we appreciate the cooperation shown by the public and industry, which has allowed us to ease restrictions and permit indoor facilities to open from the 31st of August with physical distancing and enhanced hygiene measures in place. We'll shortly be publishing detailed impact assessments on the impact of restrictions on a range of activities, including fitness facilities and services.
Maurice Golden.
I thank the Minister for that answer. Many activities have been dealt a huge blow these past months. For example, grassroots football. The Third Sector Resilience Fund can help, but it is short term. Physical, mental benefits of local football clubs, especially youth clubs. Does the Minister targeted support to ensure our national game survives at a local level?
Minister Joe Fitzpatrick.
So I think I missed some of the question, but I think it was basically about grassroots sport in general and football in particular. And the member is absolutely right about the importance of grassroots sports in terms of the physical health and mental health of our population. So we've been working very closely with Scottish Football Association and other sports governing bodies to through Sports Scotland in order to maintain as much work from those sports governing bodies to support ongoing physical activity. And we've seen some really amazing examples of innovation, not just through the use of technology, but that's kind of, I guess, been most notable about how various sports governing bodies have used technology to encourage their members to keep physically active, but I absolutely recognise the challenge that we have in effectively catching up for lost time that's been lost during the lockdown.
Thank you. Question 3, James Kelly.
Thank you, Deputy Presiding Officer. To ask the Scottish Government what action it is taking to tackle health inequalities arising from COVID-19.
Cabinet Secretary Jane Freeman.
Question. There are a number of actions that we are taking. For the sake of brevity, I'll only list 2 or 3 of those. The first was the setting up of the independent expert reference group on COVID-19 and ethnicity, which brings together experts, representative groups and academics in this field, looking at the data and evidence on the disproportionate impact of the pandemic on those from our minority ethnic communities. The group's already made recommendations which we are featuring in our board mobilisation plans, and those plans have been asked to specifically make sure that they are considering how we proceed with health inequalities. We've also provided additional support to protect some of our most vulnerable people, with over 2 million to assure additional help and support for those at risk as a result of drug and alcohol use, and over 1.5 million to third sector organisations to provide emergency hotel accommodation and support for people experiencing or at risk of experiencing homelessness during the pandemic. There will be further actions planned by the government in response to what we've learned from the Equality and Fairer Scotland impact assessments that have been carried out in the development and implementation of our route map measures, and as I mentioned earlier in the answer, with particular respect to the board mobilisation plans currently being looked at and assessed, and will be part of the discussion at the recovery group, which, as the member knows, I chair.
James Kelly.
Thank the Cabinet Secretary for that answer. Yesterday's report from Public Health Scotland highlighted the fact that high excess deaths over lockdown can result from the health service not being used by those who most need it. Given the high rate of deaths in the poorest communities, and ask the Cabinet Secretary if she's concerned that a slow reopening of the health service will further escalate health inequalities.
Cabinet Secretary.
excuse me, the member raises a really important point, and it is about how well we can improve the access to healthcare facilities, health screening programmes, and primary and community-based care by those who are most in need of that access and that care. The reopening of our NHS services and the pace at which we are safely able to do that is not, I don't believe, the dominant factor here. It is, for example, how well we can roll out community link workers, how much we can learn from the evidence and the impact of, for example, the deep end practices, how we can ensure that our focus in remobilising our NHS is very much on primary, community and social care and not exclusively on hospital-based care. And that is part of the commission, if you like, that each of our health boards was set by me, and is the work that we've got underway, including a subgroup to that recovery group looking in particular at primary and community healthcare.
Thank you very much. Question 4, Peter Chapman.
I thank you, Deputy Presiding Officer. To ask the Scottish Government for what reason only one of 30 bars in Aberdeen has reportedly been asked to provide its contact tracing list since the implementation of the local lockdown.
Cabinet Secretary Jean Freeman.
So the decisions on how to respond in detail to any cluster of cases or outbreak that follows from that is very much a decision that is led by the local incident management team in terms of their understanding of the trigger case, if you like, and the circumstances around that, and where the other cases have come and how they have linked one to the other. So if you look, for example, at the way in which the local IMT in Dumfries and Galloway responded to that outbreak compared to the IMT in Lanarkshire to that particular outbreak compared to Aberdeen, you will see that there are core actions that run through all of them, but they apply that expert knowledge and understanding on health protection to the particular circumstances. So the local IMT looked at what it needed to know. It started with the Hawthorne bar, which was the one bar that they asked for contact details from. They got those in paper and in digital form, and they could then see and trace individual contacts from contacts, further contacts. That let them understand the number of premises in the nighttime economy that were impacted without having to ask each of those premises for the specific contact details that they might be collecting. And the IMT debated more than once how best to deal with those different premises, and as the member knows, in the end concluded that the right way to deal with that and make sure that everyone who may be affected or may be concerned or may be anxious knew what they were doing was to publish the details of all the premises they knew may have had an individual who was a contact of the original cases in those premises, but they may not have been in the premises for long enough or in close enough contact with another to qualify as a close contact.
Peter Chapman.
Well, I thank the Cabinet Secretary for that answer, but I don't actually accept it. You know, many bars in Aberdeen connected to the COVID outbreak have reported that no one from Environmental Health or NHS Grampian has attempted to contact them or to gather their contact list. And I think this is a complete dereliction of duty and further highlights the failings of the Scottish Government's track and trace system, and I believe it inevitably meant the lockdown lasted for longer than necessary. So can the Cabinet Secretary give a commitment to Parliament that lessons have been learned and that businesses will be involved in future contact tracing instead of being left in the dark as they were in Aberdeen?
Cabinet Secretary.
Well, regrettably, Mr Chapman has got absolutely no evidence at all for the assertion he's just been made. The NHS Test and Protect programme is proving itself to be highly effective in a range of different outbreaks, from Dumfries and Galloway around Gretna and Annan, right through to a complex outbreak in Aberdeen, to the current one that is successfully being managed in Tayside. All of them different, all of them complex, and all of them being managed effectively because we do not have a blanket national approach, but rest on the expertise of public health professionals through the IMT, working with local authorities, the NHS boards and other colleagues. So I don't accept what Mr Chapman has said at all. I will give no such guarantee because I do not think a politician should overrule the professional expertise of clinicians, health protection experts, public health academics and others who also know their local area. That's why our Test and Protect programme works so successfully, because it is that combination of national support and local expertise that is so far proving to be a very effective Test and Protect system.
Question 5, Murdo Fraser. I'm afraid Murdo Fraser's question was not audible. I wonder if that can be addressed. No, I'm afraid Mr. Fraser's question was not heard. I'm looking at the Cabinet Secretary and I think she is of the same experience. I wonder if it's possible to come back to Mr. Fraser. If not, we'll move on and hope to come back to Mr. Fraser if time allows. And can I take question 6, Bill Bowen?
Thank you, Presiding Officer. To ask the Scottish Government what analysis the Drug Deaths Task Force has made of the impact of COVID-19 pandemic.
Minister Joe Fitzpatrick.
Both the task force and I were acutely aware of the risks that the pandemic and the resulting changes in how services were delivered as a result of lockdown measures could pose to those reliant upon treatment and support. Task force have continued to meet regularly throughout the pandemic and took forward a range of work to mitigate these risks. That included the rapid development of a series of recommendations that were implemented by the Scottish Government and others.
I thank the Minister for that answer. Fake Valium and drugs from so-called pill presses have anecdotally had a crippling effect on health in Dundee, where etizolam-related deaths rocketed by 500% in 2018. The drug deaths toll for 2019 will not be known until December at the earliest, I understand, and experts are fearing the worst. Can the Minister indicate whether the task force believes COVID will have affected deaths caused by these drugs?
Minister Joe Fitzpatrick.
So the member question around fake Valium is hugely important. It's something that really concerns me, and I think anecdotally we are hearing increasing concern around this across Scotland. I think this is one of the areas where hopefully ourselves and our UK Government colleagues can work together on. Right now, you can go online, I won't name particular websites, but you can go online and buy a pill press for a relatively small amount of money that can churn these lethal pills out by the thousands. I can't understand a justification for such devices, so I really hope this is something that we can work, the Scottish Government, UK Government, Welsh Government and Northern Irish Government work together to regulate the sale of these pill presses, which I think are potentially responsible for a large amount of that really dangerous street Valium and other pills which are circulating around Scotland and elsewhere in the UK.
Thank you very much. Can we see if Murdo Fraser is now able to ask his question? No, I'm afraid Mr. Fraser remains uncharacteristically silent, and so we'll move very rapidly to Joan McAlpine, and apologies to Mr. Fraser. Joan McAlpine.
Government whether it will fully implement the recommendations of the Cumberledge Review regarding children damaged by sodium valproate, and if so, what the timescales will be?
Cabinet Secretary.
Thank you very much. And before I answer this, I will provide Mr. Fraser with a written answer to his question. And if he has further questions he wants to give me, then I'd be very happy to respond to those offline, as it were. In terms of Ms McAlpine's question, I have welcomed the Baroness Cumberledge report, and I know that a number of patients in Scotland provided evidence to her review. The review related primarily to NHS England and processes in England more generally, but there are lessons and implications for us here in Scotland. So we're giving careful consideration to all the recommendations of the report, and we'll give a response very shortly to all of those. Our sodium valproate advisory group met earlier this month. It is chaired by our Chief Pharmaceutical Officer to discuss the review and the next steps to be applied at a Scottish level. This week, our officials met with representatives from patient groups to listen to their concerns and inform future action and our response. So as we finalise the detail of that, we'll certainly make sure that not only Ms McAlpine but all members are aware of how we intend to take forward those recommendations and the timescale within which we'll do that.
Thank you very much for that answer. My constituents, Charlie and Leslie Bethune, contacted me for help as their adopted daughter Autumn, aged 7, has fetal valproate spectrum disorder caused by her birth mother having taken this drug to control seizures during pregnancy. Mr. and Mrs. Bethune are members of the newly formed First Do No Harm Valproate Scotland campaign group. The Cabinet Secretary did mention that she had met with patients groups. Can she confirm that this parents group will be represented in any task force formed to take forward the report recommendations so that they can help shape a package of care and support for children like Autumn who have very considerable needs indeed?
Cabinet Secretary.
So I'm grateful to Ms McAlpine for that additional question. Whether or not there is a task force as such will be primarily for the UK government to respond to in terms of the Cumberledge report. In terms of our response as a Scottish government, we will, as I've said, already been speaking to make sure that we hear the patient voice, and that particular sodium valproate advisory group will ensure that it reaches out so that it can hear what patients' experience has been and engage them in helping to form our recommendations. We will look to do that across all the areas of the Cumberledge report as we respond to it.
Thank you very much, and my apologies to both Murdo Fraser and Mark Ruskell, as well as to other colleagues who wished supplementary questions, but we really are out of time, so that now concludes portfolio questions on health and sport, and I close this meeting of Parliament.